People often think that high blood pressure is just a number that they get read at the doctor's office. I think what people need to know is behind that number is risk of a heart attack, risk of a stroke, things that could end your life very quickly.
We are very concerned as physicians about high blood pressure because we know that it increases the risks of heart attacks and strokes. Hypertension is the leading risk factor for preventable death in Canada. If we can find cases of hypertension and effectively treat them, we can improve the survival.
My name is Kelsey Heffernan. I'm a registered nurse. I work at the Children's Hospital specializing in mental health. And over the last year, I was diagnosed with hypertension.
An estimated 7.5 million Canadians have hypertension, also known as high blood pressure. As the symptoms of hypertension are typically silent, blood pressure measurement or monitoring is key to detection.
I have many chronic conditions that require me to go to see my endocrinologist, Dr. Rabi, as well as my family doctor quite frequently.
If your blood pressure is between 140 and 160, that suggests that you're certainly someone who's at risk for developing significant hypertension. And this is a point where we definitely want to talk to you about things that you can do to reduce your personal risk of developing hypertension. Another criteria that we take into account when making a diagnosis of high blood pressure is what is your general health? Do you have any other risk factors for complications related to hypertension, such as kidney disease or diabetes?
Angelique Berg is the Chief Executive Officer with Hypertension Canada.
The great news is that blood pressure is highly responsive to the things that we do every day, our lifestyle choices, our diet, exercise, and other factors.
In particular, patients should be avoiding salt, so keeping their salt intake to less than a teaspoon of salt a day. They should be eating a diet that's rich in fresh fruits and vegetables. They should be trying to exercise at least 30 minutes a day, most days of the week, and they should try to stop smoking and limit their use of alcohol.
So we're really excited about the Get Down BP program. The goal of the Get Down BP program is to get Canadians thinking about their blood pressure and thinking about how to manage that every day for lifelong health. The only way that we know if we have high blood pressure is to measure it.
Home monitoring of my blood pressure can be annoying, but also convenient. It's nice to be able to take it at home. I check my blood pressure at least 3 times a week. When I was titrating my medication and figuring it out, I was doing it daily, remembering to write it down. Thank goodness we have cell phones now. I could log it all and have that data.
It's especially important to use the most accurate methods and the most accurate devices available.
As home blood pressure monitoring results may vary depending on the device, it is recommended to use a device that has been tested and validated to allow more accurate measurement.
Hypertension is actually a really helpful red flag for us. It tells us that we're at risk for a number of chronic diseases that can really damage our health.
Hearing that I had high blood pressure, hypertension, was like, oh, here we go, another thing. I was also thankful to know that I had hypertension because often you don't find out and it's just something that ticks along until it becomes a really big problem.
In the last 2 years, we've made some significant changes to our guidelines regarding blood pressure management, particularly if you're an individual at increased risk for adverse outcomes such as heart disease or stroke. And our guidelines now say that if you're an individual that has a pre-existing diagnosis of heart disease, so if you have kidney disease or you're an older adult, we actually are now recommending that we treat your blood pressure quite aggressively, that we start treatment if your blood pressure is consistently above 130, and we treat to a target of 120 millimeters systolic.
But making sure I took the pill every morning at the same time every day, making sure that even if it was a busy week, I made sure to take my blood pressure.
Recent trials have suggested that more intensive or tighter blood pressure control may have greater benefits in certain populations. So if you have diabetes, we tend to target a lower blood pressure of 130. And if you have a history of heart disease, kidney disease, or you're an older adult, we believe, based on current evidence, that a lower blood pressure, such as less than 120, is going to provide you with increased benefits.
One of the biggest innovations in high blood pressure is the introduction of therapies that make it easier and easier for patients to treat their high blood pressure.
2 ways that we can do this is by focusing on using single pill combination therapies where you get 2 pills in one, or using long-acting formulations that allow you to reduce the number of blood pressure pills to 1 per day. Both of these strategies are really effective at getting people on their medications and staying on their medications. The good news is we know more than ever about hypertension. We know how to recognize it and we know how to treat it.
Life is short, and I think everything happens for a reason. So if you went to that doctor's office and there was a high reading, there was a reason behind that. Maybe it was to keep you from 5 years down the road having a heart attack and missing out on important things in life.
To learn more about recent guidelines for diagnosing and managing high blood pressure, visit the website below and/or speak with your doctor.